Welcome back to Autonomy Health. And today we're going to talk about something that apparently still confuses way too many people: the difference between medical care and health care. This is one of my biggest professional irritations. Not a mild annoyance, a grinding my teeth irritation. Because people constantly mix these two up. And that confusion is why half the public debates around health sound like toddlers arguing about taxes. So let's get this straight right now. Healthcare is the big umbrella. Medical care is just one spoke. Medical care is healthcare. Healthcare is not medical care. Thumbs are fingers. Fingers are not thumbs. This should not be controversial. And yet, every time someone says healthcare should be free, a small part of my soul leaves my body. Healthcare is not free. Healthcare will never be free. Medical care, sure, that can be free. Healthcare? Absolutely not. Healthcare includes everything that keeps you healthy: personal hygiene, nutrition, exercise, safe sex, public health measures, basic self-awareness. Medical care is what happens when all of that fails and you end up in a doctor's office. Medical care requires licensed professionals: doctors, nurses, dentists, surgeons. Healthcare can be done by anyone. And more importantly, it's supposed to be done by you. Yes, you. Learning how your body works? Healthcare. Understanding disease risks? Healthcare. Not doing obviously stupid things repeatedly? Also healthcare. Dental hygiene is healthcare. Brushing your teeth, flossing, getting your yearly cleaning. That's healthcare because it prevents disease and keeps you out of the dentist chair. The irony is delicious. Even getting an annual physical is healthcare. You're checking to make sure things aren't broken yet. Once they are broken, congratulations, you've graduated to medical care. Now here's where reality really starts to upset people. There are massive parts of healthcare that no government can do for you. Ever. For example, using a condom. That is healthcare. And unless you want the government stationed in your bedroom with a clipboard, that responsibility is on you. Using a condom reduces STIs and unwanted pregnancies. Not using one increases your risk of everything from chlamydia to HIV. This is not advanced science. This is biology with subtitles. Eating properly is healthcare. If your diet consists of fast food, alcohol, and vibes, you are actively booking future medical appointments. Meanwhile, fiber, hydration, and balanced meals dramatically reduce your need for doctors later. Now, if healthcare were truly free and entirely the government's responsibility, that would mean officials knocking on your door every time you bring a Tinder match home to make sure you're practicing safe sex. Somehow, people don't like that idea. Weird. Here's the part nobody wants to admit. People who focus on healthcare spend far less on medical care. A condom costs a few dollars. Raising a child costs hundreds of thousands. Treating HIV costs thousands per month. Do the math. Slowly. People love saying eating healthy is expensive. You know what's more expensive? Dialysis. Diabetes-related dialysis can cost up to $100,000 per patient per year. But yes, please tell me again how broccoli is unaffordable. Modern medicine lets people live longer, but living longer and living well are not the same thing. Medical care extends existence. It does not guarantee quality. We now have people in their 80s taking 10 medications, scheduling surgeries like seasonal events, and living inside a pharmacy. They're alive, but miserable, exhausted, and expensive to keep alive. Focus on healthcare, and you might reach your 70s before needing daily prescriptions. Focus only on medical care, and you could start medications in your 30s and never stop. Healthcare gives you a longer, functional life. Medical care gives you a longer, medicated life. And yes, this matters economically. Healthier people miss fewer workdays, assuming sick days are actually for sickness. When people take care of themselves, they remain productive longer. That's good for companies and good for society. When individuals focus on healthcare, society improves. Disease rates drop, public health costs fall, people suffer less. Remember the pandemic? People were miserable. The moment the threat disappeared, collective happiness returned. Whether it's a virus or chronic disease like diabetes affecting massive portions of the population, the result is the same: widespread misery. Prevention beats cure. Every time.
But here's the uncomfortable part. Not everyone benefits from a healthier population. Governments worldwide are struggling with aging populations. Pension systems were designed when people retired at 65 and died shortly after. Now people retire at 65 and live to 80 or 90. That's 10 to 20 extra years of payouts nobody budgeted for. That's why politicians suddenly care about raising the retirement age. Funny how that works. Add declining birth rates to the mix, and now fewer workers are supporting more retirees. That's a math problem no one wants to solve honestly. Big Pharma also isn't thrilled about healthcare-focused populations. Pharmaceutical companies make money when people are sick. Sick people need prescriptions. Prescriptions equal revenue. HIV medication in Canada can cost $2,000 per month. No cure means decades of guaranteed income from one patient. If that patient had used a condom, that revenue disappears. Same story with cancer, heart disease, and other chronic conditions. Long illness equals long profits. Doctors may not love this idea either. Most doctors are paid fee-for-service. More patients equals more income. A healthier society means fewer visits. Chronic illness is great for billing. That HIV patient? Regular visits forever. Medication checks, side effects, mental health, infections, each visit gets billed. So yes, from a purely financial standpoint, a reckless population is more profitable than a healthy one. Still, none of that stops you from brushing your teeth, eating fiber, drinking water, using condoms, or avoiding smoking and excess alcohol. They can't stop you. They can't regulate common sense. And they can't outlaw personal responsibility. Yet. As someone once said, there are no solutions in life, only trade-offs. So listen carefully when politicians talk about healthcare. Ask whether they mean healthcare or medical care, and who actually benefits from the distinction. Focus on quality of life, not just staying alive out of spite. Living longer doesn't matter if you're miserable, medicated, and dependent for decades. Let me know what you think. Questions and comments, if you're still with me.